We're talking via Skype about repeated concussion injuries and possible ties to violent behavior with Dr. Zachary Litvack. Dr. Litvack is a neurosurgeon and director of Neurotrauma at George Washington Medical Faculty Associates. Doctor, is there any link between repeated concussions and violent behavior?
Mark, there is. And I think it's important for people to understand that there's a difference, as you pointed out, between a single concussion, which somebody can recover from completely, and repeated head trauma, which leads to what we now call chronic traumatic encephalopathy. That's a fancy way of describing a degenerative disease of the brain that occurs in response to repeated trauma. It's very similar to Alzheimer's type dementia, Parkinson's type dementia, and one of the aspects of this degenerative disease is aggressive or violent behavior.
How do we see the behavior? Does it take time? Does it take years? Can it be immediate? What should we be on the lookout for?
Typically, there is a latency or a lag time between exposures to the repeated trauma and the manifestation of the behavior. But what we don't understand is exactly how long that is and how that varies from person to person, or what the exact response is between the amount of repeated trauma and how quickly they develop these symptoms. There are three phases of behavior that have been described in this neurodegenerative disease. The first one is similar to early stage Alzheimer's or early stage Parkinsonism, where it tends more to be short-term memory issues. It's not until the second phase that you see the spontaneous, impulsive, potentially violent behavior. And then in the late stage of this disease, when you start seeing full-blown dementia-type symptoms and Parkinsonism or movement disorders.
Violence, yelling, physical violence, all of the above?
All of the above, and there's, again, no way to predict how this is going to manifest on an individual level. But if you think of the frontal lobe as your Jiminy Cricket, right, the one that tells you what's okay to do and what's not okay to do, and suddenly that doesn't work anymore, you're going to uncover a lot of impulsive and potentially violent behavior. But that violent behavior is very dependent on the individual themselves. So it could be verbal only, yelling, screaming, verbal abuse. It could be physical, depending on that patient's background and history.
Is there anything that can be done to reverse it?
Similar to other degenerative diseases, it seems to be that once this process starts, it can't be reversed. There are some medications for some of the other degenerative diseases that slow progression down, but as far as we can tell, nothing that reverses it.
And does it just get worse over time?
It does. So it does not necessarily require continued or ongoing exposure to trauma or concussion. And like I said, there is a lag time. So this could be a professional athlete of any kind, football, boxing, hockey, any full contact sport, and it could be 20 years later that they start to manifest symptoms. They're not playing anymore. They're not exposed to the trauma anymore, but once that ball starts rolling, it doesn't stop.
Do we see a lot of links with alcohol and drugs?
There is a depression component to this, just as there is at the onset of other degenerative diseases, and alcohol and other substances may be used by an individual to self-medicate, and I'm sure you're leading up to that will also contribute to violent behavior.
Is there any sport that you're seeing this worse than others?
Well, I think obviously, the one that's in the news all the time is American football. And I think it has to do with the scale of the enterprise along with the violence. But as you mentioned, we see it in boxers, we see it in hockey players, we see it in NFL athletes, and not just in America, but worldwide. But I think the one that is in the popular eye, so to speak, is football.
And what about parents of children who are playing these sports? Are helmets going to make a difference? Is there anything that they should be doing?
Helmets absolutely make a difference. They've made incredible strides in the quality of the helmets in terms of protecting players from impact. Combined with that have been changes in the rules, right? So, for many years, spearing was not outlawed, and now it is. So direct impacts to the head have been reduced. I think the bigger problem, again, goes back to the size and scale of the professional enterprises, and as the violence is rewarded, so to speak, in terms of high pay and high viewership, that trickles down, and we see kids in high school playing much more violently than we ever did.